Social workers in the Nelson Mandela Bay Metro in the Eastern Cape say they fear for their lives because criminals are targeting them during home visits. The story goes that the criminals are waiting until those healthcare workers enter a house before ambushing them. So many social workers now seem to have stopped their home visits. Newzroom Afrika Sipha Kema is in Rocklands in Kariega and joins us with more on that story. Sipha, good morning. Again, you know, from healthcare workers inside hospitals being attacked to emergency services, paramedics being attacked when they respond to incidents of an emergency medical nature or medical emergency nature, to now, social workers. Where is safe in South Africa for people to do their work? It would seem in the Eastern Cape, not too many places. Tell us more.
Absolutely, Iman, especially the Nelson Mandela Bay Metro. And I mean, as you mentioned that before, as we've reported, the main targets for these criminals was actually EMS workers or services, and also also delivery vans and vehicles that have to be escorted as well inside these townships. But now it seems as though they've changed the focus, or rather broadened their horizon now to targeting social workers. And to tell us more on this, we were discussing this at the engagement hosted by the Department of Social Development in the Eastern Cape. And this is one of the topics that came about here, Iman, by the Chief Director of Institutional Support Services, Mr. Thembile Ngqabai. Thank you so much, Mr. Ngqabai, for joining us on Newsroom. I mean, this is quite shocking that social workers now have become targets, and it's not easy for them now to do their rounds and home visits anymore.
Yes, good morning to you and the viewers. Yes, that's a big problem. Remember, the work of a social worker starts with the community coming to the office, or a referral in one way or the other, either through our partners, NPOs, or somebody can just, let us know that there's a problem in a particular family. So the work of a social worker then begins then, because an assessment has to be done. We call it home visit. Now, it is during those home visits that then these criminals, it seems they have profiled social workers, and what they do is not the same as how they attack, ambulances and others. They wait for social workers to get into the home, and then wait for them next to the vehicle. So when they come out, and unfortunately, all these robberies, they happen with with a gun. So they will point a gun at social workers and take the key, throw it on top of the roof. They don't even take the car. And then they take phones, wallets, laptops, such that now social workers no longer carry these gadgets when they do home visits. Remember, a home visit, sometimes it has to be recorded. Now, without those tools, it means they must carry, a pen and a pad.
And I believe, Mr. Ngqabai, for some time, the social workers were not doing home visits until a solution was reached to make sure that they are safe.
Indeed, they stopped, and we couldn't do anything because, we had noticed that those who are victims of these crimes, they tend to be on prolonged sick leave, affecting now productivity at work. So we about 18 months ago, we convened a session of all of the security cluster as a whole. And we invited CPFs and everybody, even, active stakeholders in the communities to find a solution. And out of that, the police and Metropolis, we agreed that, per station precinct, we must submit a schedule of home visits. We do that, but the problem is that now this escort of social workers is competing with other priorities. A practical example is that During a home visit, the police will then be called to go and reinforce because there's a service delivery protest. So it doesn't always work practical. But here's another problem. It makes us look bad in courts. Remember, everything that the social workers do, it has to be confirmed by a court. So if it's the removal of a child, a court must issue an order. Now, the problem that we have is that the social workers now end up risking, because there's a court date, the magistrate is expecting a social worker to appear in person and present the report. And the social worker now can't make a home visit. So they take risks. And unfortunately, when we understand why they take the risks, but even that sacrifice, they end up being victims.
Have you reached a solution that is working now, or are you still using police escorts?
We are using police escorts, but we have tried to reinforce through our own resources, which are, not sufficient. So remember, even the issue of vehicles, we don't have many. So if we have to take one out of service delivery, to be the one that does the escorts, it reduces the amount of work that social workers would do. So we do not have a permanent solution yet. And that permanent solution will come out of collaboration with law enforcement, unfortunately.
Yeah, all right. Thank you so much, Mr. Thembile Ngabayi from the Department of Social Development, Chief Director of Institutional Support Services, Iman, telling us about the current crisis, one of the issues facing the department, which of course it is a huge problem, Iman. I mean, hearing him talk about how it affects the public, how it affects the services provided by the department and also social workers because of criminals targeting social workers in the Nelson Mandela Bay Metro townships. It really is a problem, but also having to spend more money ensuring their safety, money that the department doesn't have, Iman.